to questions and comments yourself, so perhaps you can go back to those other people there. So so staying in Australia, and James has already mentioned his colleague Kootsy, or Justin Canuto, and so Kootsy is a Wagga man from the Torres Strait. He was born and raised on Udingi country, so Cairns, far north Queensland. He's also an associate professor of Aboriginal and Torres Strait Islander male health and well-being at Flinders University. So Kootsy has developed strong, meaningful relationships with Aboriginal and Torres Strait Islander elders, traditional owners, leaders of Aboriginal and Torres Strait Islander communities, and community organisations across the country. So Kootsy is going to share his insights on the significance of Aboriginal and Torres Strait Islander male leadership in improving the health and well-being of men. So Namai Halimai Kootsy, and we look forward to this presentation. Thank you.
Thank you, Fiona. Thank you, everybody, and to you and Ellie for inviting me to this little shindig. I appreciate it. So just, I'm not looking away from everybody, but my screen is over here, so that's my best profile. All right, so improving the health and well-being of our men, the significance of Aboriginal and Torres Strait Islander male leadership and health. So this presentation will be a bit less scientific than everyone else's, and it'll be more of a grounding and highlight the importance of leadership within, so not from a macro level like Alan and Mark were looking at, but I'm looking at a micro level, so I'm looking at a population within a population. So, and how important it is to have people at certain levels and in certain areas to make sure that we can do the research we want to do with our mob, you know, for our mob. That's just a picture of where we are right now. Okay, so I acknowledge the Larrakia people as the traditional owners of the Darwin region where I live and work. I recognise the Larrakia people's cultural, spiritual, physical and emotional connection with their land. I honour and pay my respects to Larrakia elders, both past and present, and all generations of Larrakia people now and into the future. I also pay my respects to other Indigenous members of the audience, including our non-Indigenous allies. All right, so what to expect? Who I am, so I'll position myself so it can help you understand where I'm coming from and why I do things, the rationale of why I do the research. I will touch on the 2 grants that I'm currently leading, but most importantly, I'll highlight the significance of Aboriginal and Torres Strait Islander male leadership in health research, so particularly about my research and my journey as we carry on. So who am I? As Fiona was saying, I'm a Wagga man, and my totem is the Cadell, the saltwater crocodile. It's a bit busy, this slide, but bear with me, I'll walk you through it. So number 1, Mobiag. So Mobiag is where my father's family come from. They moved from Mobiag, most of them moved from Mobiag to Bardu a long time ago to chase down some more resources like fresh water, more people, hang out. So they're the western side of, inner western of the Torres Strait. Then you've got Udingi country, number 3. That's where I was born and raised. And number 4 is Narapai, which is Horn Island. So Horn Island is where me and my wife recently lived. And just to keep her happy, number 5 is Nagi. That's where her family are from, the Mills family, and the Torres Strait. It's a little dot, so without that big circle around it, you wouldn't see it. And of course, that's our flag, the Torres Strait Islander flag. So that's who I am, that's where I come from. And throughout this presentation, there's a map of Australia with all the Aboriginal and Torres Strait Islander countries on it. And I'll take you on a bit of a journey because it's a big place, you know, so stick with me. So my research, I unapologetically work exclusively with Aboriginal and Torres Strait Islander males because it makes sense to stick to my strengths. You know, I'm a Torres Strait Islander male. I was born this way. I know my bits and pieces, very similar to other males' bits and pieces. So, you know, it was easy enough for me to stick to this. I look at primary healthcare service utilisation and engagement, social, emotional well-being and co-design programs with communities, and fatherhood. So what do I look at this stuff? Well, primary healthcare services can have the latest technology and purpose-built centres employ the best staff available, and provide a plethora of programs. But all this remains ineffective if we choose not to use them. Now, if we don't walk through the front door, how can I get any better? If I'm not tempted to go and see a doctor, if they're not going to provide me with a service, whether it be showing me respect when I first walk into the centre, not answering the questions to how I need them answered, if they're not going to provide a service that I feel comfortable with, then there's no way I'm going back. There's no way I'm going to go to another doctor, and there's no way that I can confidently tell my children or my nephews that, you should be going to the doctor too, because I don't want to put them through that either. We do know some things though. We know that Aboriginal and Torres Strait Islander men are traditionally not involved in the planning, delivery, or evaluation of the healthcare services and programs afforded to us. We're not asked for the most part, what we think should be happening. We're normally told what should be happening for us, to us, but never by us. And it's all the research we've done, these are simple little barriers, and I think this translates across wherever there's indigenous populations across the country. If you're not going to listen, understand, and collaborate with the indigenous people, then how can you expect indigenous people to progress or improve their health? You can't. And again, we need to do things differently, as I said, in a logical way forward is the research and initiatives conceived by, led by, governed by, and truly supported by Aboriginal and Torres Strait Islander men. It's pretty basic. It's not rocket science. All right, so now getting back to this leadership business. Some of you might know some of these fellas here. Doesn't matter if you don't. But these are some of the leaders who have got me to the position I am today. So Professor Alex Brown, he was my PhD supervisor, and working with him, it just highlighted how much needs to be done with Aboriginal and Torres Strait Islander male health and wellbeing. It's heartbreaking and daunting just how bad our situation is. And without the human resources to do the work with our men, we struggle to get the job done. There's just not enough of us looking at stuff we need to be looking at. Professor James Ward, another Aboriginal fellow, he was influential in opening my eyes and mind to the art of writing grants. He instilled in me that no reviewer cares about what I think or how I feel. They just need to be convinced that what I am writing is important for them. So that's our job as a researcher. So, we're sitting between the academic world and the community. And to get the bucks to do the research with the community, we've got to make those fellows on the academic side, their institutions, make them happy. So they will provide the funds so we can go back to the community to do what we need to do with the community. Uncle Mark Winnetong and Uncle Mick Adams, they're a couple of the OGs within the Aboriginal and Torres Strait Islander male health and wellbeing space. They've been around forever. There's nothing you can do about Aboriginal and Torres Strait Islander male health without these two fellas' name popping up somewhere, whether it be in a publication, whether it be on a panel, or they're everywhere. So, and without them, the James Wards, the Alex Browns don't exist. And without that, I don't exist, if that makes sense. And Dr. E.J. Kabila, he's a Larrakia man. This is his country. He's one of my best mates. He's a lawyer at the University of Melbourne, and he's somebody that I need in my life to keep me grounded. And we keep bouncing things off each other all the time and making sure that what we're doing is actually important for the community first, and then for our families. Because no one likes someone with a big ego. That just doesn't happen. So why is this all important? Well, as this slide here will show you, over the 10-year period from 2011 to 2020, 0.01% of all ARC funds awarded went to Aboriginal and Torres Strait Islander, specific to Aboriginal and Torres Strait Islander men's health, and only 0.29% of all NHMRC funds were awarded to Aboriginal and Torres Strait Islander specific research. So these are the two big national Category 1 grant funding mob. And even though that we're only 1% of the population, Aboriginal and Torres Strait Islander males 15 years and older, We have a burden of disease 2.3 times that of non-Indigenous people, yet we can't even get 0.3% of funding to do research with our men. So there's a lot of reasons why. It could be about there's not enough of us doing it. So the human resources, researchers aren't interested in Aboriginal and Torres Strait Islander male health. Too hard, or maybe there are a whole bunch of us applying for grants and we're just not good enough. We're just not getting it. But it's something that we need to unpack a bit more because, again, we're only 1% of the population, but we're winning everywhere when it comes to bad outcomes. Our mortality rates are the worst. So it baffles me how a country rich like Australia cannot do better anyway for the 1%. And like many have said before, we are invisible. And for Torres Strait Islander fellas, we're a minority within a minority within a very rich country. So it's a difficult task, and this is why the leadership of these fellas that have helped pave the way for me is it's important. So moving on to the grant. So this is the NHMRC. This is what all our grants, if we win a grant, it all comes under this little umbrella. It's called Enough Talk, Time for Action, ETA. And I'll get back towards the end of this presentation and explain what the picture means. So the ETA grant started down in Ghana country, down in South Australia. And it's all about shifting away from describing the health challenges facing Aboriginal and Torres Strait Islander men, and instead delivering an alternate solution aimed at improving men's health access and quality of care. So we've gone into the health service and we've spoken to the staff, and we've spoken to the ETA participants just recently after a year of work, and we've asked them what's working, what's going on, what's happening. And looking at the staff perspective is really important because we want to know what they think, that if what they think they are doing is actually beneficial for the men. And it's been very good. So it went from 2020 to 2024. Of course, 2020 and 2021 was wiped out because of COVID. So we've just finished our first iteration, our first 12 months of interviews with staff and the men. And we got I can't go into the findings because we want to publish them, and I'll get in trouble for this early release. But what occurred was we sent it to the executive director of the Aboriginal Health Network there in South Australia, and he happens to be an Aboriginal man, Kurt Towers. And this was his response. He said, and at the end he says, "I look forward to sharing this with the organisation and implementing a shake-up on how we sustainably and safely deliver services and programs to our men and young people." Now, if it was anybody else, a non-Indigenous fellow sending me an email back like that, I would just go, yeah, bottom drawer stuff, to the bottom it goes. But he Aboriginal fellow, so he has responsibility, so we can be confident in knowing that he's going to shake up stuff within the health service. And we know this because a couple of years ago we took him out to our Strong Dads, Strong Futures research. So we went right through South Australia. So that photos there is of Kubapiti, and that's Kurt sitting down in the dirt. He gets around in his flash suit and everything like that because that's part of his role at SA Health. But he gets research. He understands research. He understands the importance that research can make when he goes to sit down with all the executives of South Australian Health. Without research, he can't push an agenda for Aboriginal and Torres Strait Islander male health. So having him in that position, in that leadership role, is very important for us. Otherwise, we can't do what we want to do. We can't support our men. And the medical research fund that we've got, we started this in Larrakia country just this year. So my wife and I left Adelaide, zipped up to Darwin here with James, and we've started the MRFF up here. And this is 2 photos here of Darwin Men's Interagency Network. So that's about 28 organisations, male organisations, Indigenous and non-Indigenous. They get together 4 times a year to discuss what's happening amongst all the services and all the organizations. And within that network, we get to see some of the young leaders coming through, you know, young entrepreneurs starting off their business, looking at the social emotional well-being of young men. And it's very promising, and we get to be the secretariat of this. So we've got our fingers on the pulse, so to speak, in this region. And it's really beneficial to the research that we want to do and the research the community and the direction of the research community wants us to take. Another photo there to the right or left, I don't know what your screen looks like, is of the fathering research that we're doing, which is led by Professor Kath Chamberlain from Uni Melbourne. And, you know, for some of these men, this is the first time they get to talk about being a dad, you know, engaging about men's stuff. Yeah, another presentation, another time. And we've got 2 sites we're piloting the social emotional wellbeing grants in, and one is on Mallet country, which is 2.5 hours, 2.5 hours southwest of Darwin. And the only reason we can do it there is because of another leader. So in the bottom right-hand corner of the screen, or left, wherever you are, there's 2 blokes standing there. The big fellow with his hand out, his name John Bonson. He's a traditional owner of the area around there. He's there explaining to us about the country and what everything is, which is always awesome. But not only is he a traditional owner of his country, he's also a night patrol man, and he's also the president of the football club. So the population here, Nayu, Daly River, some might know of, it's about 350 people, 92% are Indigenous. And without his leadership and his role within the community, so his leadership within the community, this community will never get a chance to do any Aboriginal and Torres Strait Islander male health research. You know, why would you even choose a little community, you know? So he asked us to come out there. We went out there, we met the community wanted to engage, community want to do stuff. It's just great when communities start to drive and govern everything they want to do about themselves. So that's important, leadership again. And the other place we're working with is Wyburn. So Thursday Island in the Torres Strait. So about twice the size of Nagi, where my wife's from. But that's the other part there, is that's where we're doing our other pilot, the same as we're doing in Daly River, the Nayu community. And again, the only reason we can do that is because of the leadership of the men that are in the community. This might be the same in New Zealand with Maori fellows too. You know, you have researchers come in, do what they want to do, take what they need to take, KPI this, put on a feed, and you never come back, you know. But this is where we're from, so this is home. So there's no taking, it's all give. You must give, you know. And again, we can only do that with the support and guidance of the leaders of the community, and that's some of them there from the Wyburn Cod. So without them, without their guidance and advice and direction, then we just don't do research there. We just can't do research there. Yeah, and researchers understand that you get a grant and they say you got to do it in 5 years. Yep, all right. You have you give your timeline, your Gantt charts, and all that sort of nonsense, and for people to go, oh yeah, that's great, and at this exact moment you're going to step. No, that's it's all well and good for certain eyes, but you can't take that back to the community, you know. Or you can take the community and say, we can start now once we get ethics, but we need to finish at this mark, you know. So how it progresses, how it flows, is all going to be dependent upon the community and how they want to do it. You know, we can spend 18 months, 24 months before we put in ethics, you know. But I know that after that, in a 5-year grant, if it's taking 2 years to get ethics, that the next 3 years will be so sweet because everyone's on board, you know, everyone's rowing in the same direction. You know, it's very important. And so just to end there, the significance of male leadership in our health is critical to improving the health and well-being of our men, and genuine support from our non-Indigenous allies is always welcome. You know, don't tell us what to do. Just there, just support, enable, and trust that we know what we're doing. And when we call on you, you know, support. So about the artwork. So artwork was by Jordan Lovegrove. He's a Narrandjeri artist from South Australia. And it's all about bringing together the health services and Aboriginal and Torres Strait Islander community of Australia. So the 8 areas around there, they're all your states and territories, and it's all about everyone coming to the centre, you know, to work together to try and progress Aboriginal and Torres Strait Islander male health. I think it's very powerful. I think James is actually wearing the shirt, which is really cool. And that's all I got. So thank you for that. Yeah, if you've got any questions, or email or ask me now or whatever, I'm available. But thank you everyone.
Kia ora, Kootsy. Hey, you started off by saying your presentation wasn't going to be scientific like some of the others, but you know, just the insight that you've given, the your genuine passion and commitment to engaging with and working with and being led and driven by the priority of men in those Aboriginal and Torres Strait Islander communities came across so strongly, and it was very, very powerful, and I really appreciated that. P-values and confidence intervals are all very well and good, but before we get to p-values and confidence intervals and statistics, you know, there are people behind all of those. And that came, your focus on the people came across really strongly. So yes, thank you so much for that. I'm not sure if we've got any specific questions for you in the chat at the moment, but some people are putting questions up after the presentation, so keep your eye on that. So I can see that Mr. Adrian Tapato, who's on after lunch, appears to have arrived. It looks somewhere like the Kuru Lounge, so I hope he gets himself settled down. But